So welcome to part 14 of the class. So we'll start the class, right? We'll start the class. I think previously we stopped at the mechanism of migraine, right? So what happens is the vasodilation of the meningeal blood vessels occur. This leads to meningeal edema. This leads to meningeal edema. This leads to meningeal edema. So this meningeal edema, obviously it leads to compression of the vessels, thereby causing severe headache, more prominently on either side of the parietal. So either it's on the right side or it can be on the left side. So what happens is, due to vasodilation of this meningeal blood vessels, it leads to meningeal edema and compression. Meningeal edema and compression, right? So this produces migraine headache. This is the mechanism behind migraine headache. So what you will do, obviously this CGRP should be inhibited. So how can the CGRP should be inhibited? Obviously this 5-HT1B and 5-HT1D receptors should be initiated. Why? Because if these are initiated, obviously as they are inhibitory receptors, they will stop all this process. If these 5-HT1B, 1D receptors are initiated, as they produce inhibitory neurotransmitters, obviously it leads to stoppage of this process. So what you will give? You will give 5-HT1B, 1D. Actually here at the site of ganglion you will have 5-HT1F, actually 5-HT1F, and the drug is lasmiditan, the drug which acts on 5-HT1F receptor, thereby causing inhibition of the impulses. But if you ask me at the level of CGRP, at this level, which receptors will they? You will have 5-HT1B or 1D. So if these 5-HT1B or 1D receptors are activated, they will produce inhibitory neurotransmitters, thereby leading to stoppage or inhibition of all this process. All this process will be stopped. The CGRP acting on CGRP receptor, the blood vessel dilation, everything will be stopped. So what are the drugs which act on 5-HT1B, 1D receptors? Triptans, somatriptan, rizatriptan. These are the drugs which acts on 5-HT1B, 1D receptors. Now we will discuss something about treatment of migraine, very important for Neet PG. Okay, you will just check the type of migraine condition and what treatment you will give. If we just talk about the migraine treatment, normal general migraine treatment, what is the drug of choice? The drug of choice will be always triptans. What are those triptans? Sumatriptan, rizatriptan, all these triptans. What are these? Actually, what is their mechanism of action? They act on 5-HT1B or 1D. What does this receptor activation produce? They produce inhibitory neurotransmitters. So that is the reason we give these receptor activation drugs, that is triptans. Now if you ask me, what are some of the triptans? That we can give? For example, rizatriptan, right? Sumatriptan, right? Then elatriptan, right? So these three drugs are, just remember my point, these three drugs are orally fast acting, fast acting. But you have some other drugs, some other triptans called provatriptan, and one more triptan, that is naratriptan. These two drugs are slow acting oral drugs, orally slow acting drugs, right? So this is the treatment for migraine. But if the examiner asks you simply, what is the prophylaxis for migraine? Then obviously the treatment will be propranolol. That will be the drug of choice for prophylaxis of migraine. But if they ask me, give me one more drug which can be used as prophylaxis for migraine, topiramate. So it's topiramate. Okay. Now, if there is a direct question, what is the fastest acting oral triptan? The answer is very simple. It is rizatriptan. But if you ask me, sir, what about sumatriptan then? You told sumatriptan is one of the best drug in all the sumatriptans. Yes, still I say it is the best. Why? Because it is overall fastest given subcutaneous administration. But remember one thing, there is one condition that you should remember, very much important while prescribing sumatriptan, because it is contraindicated in patients suffering from angina. It is highly contraindicated in patients suffering from angina. Why? Because can anyone tell me? Because why most of the times, what is the main background pathology in case of angina? It is vasoconstriction. It is as simple, vasoconstriction leading to decrease in blood supply, or sometimes you can notify it as ischemic state, which obviously produces angina. But what do these drugs do? What do these drugs, triptans, do? Indirectly they produce vasoconstriction only, because the main reason for the migraine is vasodilation. So these triptans should do the opposite of this vasodilation, which is vasoconstriction. Indirectly. How indirectly? They will inhibit the CGRP, thereby inhibiting the vasodilation, thereby leading to vasoconstriction. But this vasoconstriction is one of the main factor for landing up to angina. So sumatriptans are highly contraindicated in patients suffering from angina, because already they have something called vasoconstrictive state. But if you give triptans, the vasoconstrictions become even more worse, right? So that is the thing that you have to remember before prescribing a triptans. And not only angina, other ischemic conditions also we discussed. Ischemic condition, because they are already devoid of blood supply due to vasoconstrictions. If you give the triptans, it will become even more worse, right? Now you can ask me one more drug called ergotamine, right? Yes, you can also use ergotamines for migraine, but still they cause gangrene of organ with end artery supply. You can use ergotamine for migraines, but still you have a serious side effect for ergotamine, that is, it causes gangrene of organ with end artery supply. Now, what are the new drugs for migraine? This is a potential MCQ for Neet. What are the new drugs? It is, I will write with red color, it is eptinizumab. Eptinizumab. This is one drug. Now there is one more drug, fremanizumab. Fremanizumab. This is one drug. And there is one more drug called galcanezumab. Galcanezumab. I'll write here. It's galcanezumab. Remember, galcanezumab. How these drugs are given? They are given subcutaneously as prophylactic. Remember this. Now you have some other drugs which are denoted as CGRP blockers. What are those drugs? They are, first one, erinumab. Next one, olcegipant. Next one, rimegepant. Guys, if these words look crooked, if these words look something like tongue twisters, but try to remember, you may get one question from this, right? Ubrogepant. Even my mouth is unable to twist for these words. Ubrogepant. So kindly, please follow with me. They can be given as oral treatment and prophylaxis also. Now we will discuss something about narcolepsy and insomnia. What is meant by insomnia? Sleeplessness. Narcolepsy and insomnia. So here I will write the disorder. Here I will write the drug. Okay. Now first one is narcolepsy. What is the drug of choice for narcolepsy? It is modafinil. Now, if you ask me for insomnia, sleeplessness, what are the drugs? For sleep induction and jet lag, what you use? The drug of choice will be Rameltion. This is very, very important drug. Please remember this. Rameltion. It's not I, sorry, it's E. See, even I make mistakes. It's not I, it's E. Rameltion. Okay. Now, what happens is, this Rameltion, why it is preferred rather than others? Because it has less dependence and less effective. It is less dependence and it is also a less effective drug only. So you have one more drug called zolpidem, right? When you will prescribe zolpidem, if the patient is non-responsive to other drugs, if a patient is non-responsive to other drugs or something like Rameltion, right? Now for sleep maintenance, for sleep induction we have seen. For sleep maintenance means the patient should sleep for continuously for some time, right? For sleep maintenance, the drug of choice will be DORA. What is DORA? DORA means dual orexin receptor antagonist. What are those DORAs? They are suvorexant. Wait, I wrote wrong. Wait. It is, what are the examples of DORA? It is suvorexant. Okay, and another one is daridorexant. These two are DORA drugs. DORA means dual orexin receptor antagonist. These drugs are used for sleep maintenance, right? And one more drug that we can use for sleep maintenance is zolpidem. That is zolpidem. If when we use zolpidem, if the so-called it's non-responsive to other drugs, then we use zolpidem, right? Till there it is okay. I think everyone heard it good. Now we will discuss something about opioid agents. Okay, we will discuss something about opioids. What are the disorders we see, and what will be the drug of choice for those disorders for prescribing opioid. Now first thing any of the faculty will speak is, first thing is when we are dealing with opioids, it is always opioid toxicity. The drug of choice will be IV naloxone. Okay, now opioid dependence. If the patient is suffering with opioid dependence, obviously what you give? Methadone or buprenorphine. But when this methadone is given, it is mainly given to decrease withdrawal symptoms. Right? Now if you want to prevent the relapse, means reoccurring of the so-called opioid dependence, if you want to prevent that relapse, then the drug becomes naltrexone. Right? Naltrexone. Now if you want to give it a labor analgesia, if you want to give an analgesic drug in active labor case, it will be wise to select morphine greater than pethidine.